I have been associated with ServeHAITI since 2002.
I've been involved for 16 years. I first went to Haiti in May of 2000.
I went on my first trip to Haiti about 7 years ago as a volunteer. I just joined the board of directors at the beginning of this year, 2017.
I took my first trip in 2014, so 3 years ago, but I heard of the organization at least maybe about 3 years before taking the trip.
On average, I go down 4 times a year, right? And I probably have been down since 2050 times.
After the first trip, I went, I was telling my wife when I got home that it's not the kind of trip you can take and say, oh, that was a nice trip. You feel called to some type of action. So
I think it'd be great if everybody could have that experience of visiting Haiti, and you bring back Haiti in your heart.
We would give the medicine to Eve, and it was just like, oh, we gave to something really cool, but we don't know what it is, right? And having the opportunity to actually put it in a bag, bring it up the mountain, and walk into the medical clinic and see the shelves bare, completely bare when you walk in, and then it kind of hits you like, this is why I brought that medication with me. You look at the final product of your work after you've unpacked all these bags and you see the clinic shelves completely stocked. I actually now see who this medication goes to and how important it is to be a part of something like this. I had no idea, and that is why I'm here today.
It really was the vision, if you will, of some folks at Sacred Heart Catholic Church in downtown Atlanta who wanted to do outreach sort of outside of our comfort zone.
Bob, have you ever been to Haiti? And I thought, no, I've never been to Haiti. Where's this coming from?
Hey, we don't want just any parish to support. We want the most in need, hardest to get to, that no other parish wants.
It's only 60 miles from Port-au-Prince, but it took like 5.5 hours to drive there originally. The roads are just terrible. You couldn't even call them roads.
And they found this big, beautiful church in Saint-Pierre, Grand-Bois, Haiti.
And then started setting up some clinics in the back of the church at Saint-Pierre, which is an old stone church, a 125-year-old church.
Before that, it was 30 years, it has been 30 years since that region has seen a medical doctor.
Nobody else was helping them. So, ServeHAITI is the only outreach for some of these people for a 4 or 5 hour walk. Some people walk for hours to just get access to the clinics.
So when you hear people talk about the lines outside of the church when they started their mission trips through Sacred Heart, that was because of the response of not having support in that region.
We were holding clinic triage basically in the back of the church. To think about where we have come from is really, it's kind of a miracle. It's astounding when you really think about it. To have a 2-story structure on that mountain that has become the focus of that area, that has become really the lifeline for thousands of people it's just kind of mind-boggling.
We went from working out of the church once a month to building a clinic, which was just a 1-story building that was a small, just a few rooms. Added a 2nd story so that they could add more, not only medical rooms, so people could be on staff. There's a constant, that ServeHAITI keeps trying to reach out and do more as the years have passed.
We see, on average, 100 patients a day. We do a birth or 2 a day. We see a malnourished child or 2 a week. Our community health workers see 1,000 families a month. We have distributed in excess of 5,000 gift of water purification buckets. We make sure that every patient that comes through the doors is treated as if they're our only patient.
The psychology of healthcare, I think, has changed in the region. People have a backstop now. They have a place to go.
I thought it was just a medical clinic, but the interesting thing that I learned was that it's really the community center. It's where everybody comes. And not only do they do medical work, you know, they have they help with the schools and the water and the medical mamba, and I mean, there's so many different things.
I think this clinic now having, you know, being a building that's staffed around the clock, has a doctor there and nurses, and more importantly, kind of as a magnet for healthcare in the areas.
We have the programs in place, we have the medical staff in place where we're saving lives. And I see a difference, you know, going back now where we used to truly just, it was almost critical care day to day. And the line outside the church was probably 1,500 people to today where people have ongoing medical care. We've drilled wells. You know, thousands of people have access to clean water that didn't before.
Staff with all Haitian doctors, nurses, community health workers, building schools, training teachers, a radio station on site. There's our water technicians that are in the field testing our gift of water buckets that we give out to make sure that they're working. Your money has gone directly to the community.
I would say your money goes very far in Grand Bois, and there are very few administrative costs associated with donations, and every little bit goes a long way in Grand Bois.
People live day-to-day life on a limb, and if you want to give to an organization where you know your money is going to count, it's going to truly save lives, that's what we're all about. I'm so proud to be a part of that. Like, we are the safety net for 65 to 80,000 people, and we're making a difference. And that's why I think people should take a look at us as an organization to truly be a part of and to contribute to.
We have a track record. You know, I can point to all of the people that we've served daily, weekly, yearly. We've been successful. We know from our community health worker program that the system that we've developed works, but it costs money.
And our main source of income to run the clinic is this fundraiser, is our fundraiser that we do once a year.
The majority of our operating costs are covered by individuals who have been giving year after year after year. I can remember when I was there in 2001, and I was shocked at how sick the people were. I remember vividly how brown the countryside was. Nothing was growing. The animals were dying. You don't see that anymore. You know, it's verdant, it's green. The people are healthy. They're working. We've made a difference. Healthy people can fend for themselves.
Get involved. Get involved in someone else's life. Step outside of yourself. Think beyond your existence and consider how your life could be expanded by connecting to someone else's life through being connected to ServeHAITI and the relationship that they have with the community, because they've built such a wonderful level of trust.